Welcome, everyone. We're here today with Maddie, celebrating National Breastfeeding Month, which is the month of August. And we're here during the second week of August, which is Native Breastfeeding Week. Maddie, welcome. If you could share with us a bit about your thoughts about breastfeeding.
Sagoli, everyone. My name is Maddie. I am a registered nurse here at the Gerald L. Ignace Indian Health Center. I am part Oneida and Chickasaw, enrolled in the Chickasaw Nation. I personally don't have my own experience with breastfeeding as I don't have any children right now, but I am able to speak on a little bit of my sister's experience. She just had a baby 2 weeks ago tomorrow, and then just like a little bit from when I was in school, in nursing school. So in nursing school, I had a rotation in the labor and delivery unit, and it was all super great. Like when mom was having her baby and everything, very emotional, saw a lot of support during that time, but then as we were able to care for mom and baby, postpartum, I definitely noticed like a lack of support when it came to breastfeeding. Even, just from some of the nurses that were coming in, you could tell that mom was eager to breastfeed, and she even had kids in the past, who she was successful with breastfeeding, but was like having troubles with this one. And I definitely noticed just like moving on very quickly. Like mom wasn't able to, latch right away, and I just felt like there wasn't enough support as far as like really taking the time, with mom and educating or helping or trying other things. It was so quick to like jump right into formula and just stick with formula like moving forward. So that was super disheartening, and I knew I didn't like that, especially as an Indigenous woman. It's very sacred, and like goes way back. It's very normal for women to breastfeed, and I think we're getting better, but definitely a lot of work still to like normalize breastfeeding, out in public and stuff like that. So, and my sister, I felt like kind of had a similar experience, from what I saw in nursing school, and just a little bit of like what I've heard. I told her, if she wanted to breastfeed and was interested in it, to just voice that and, make sure she tells the nurses, or if there was like a lactation counselor or consultant in the hospital, to really like emphasize like, hey, this is important to me. And, because for some people it does come really naturally and it's easy and doesn't seem like there's a lot of work to it, but it's totally normal for it to be a lot of work. I've learned from one of our lactation counselors that it's those first few days and weeks, it's just such like a learning experience, like for mom from baby and vice versa, that, so much time has to be put into that, you really have to work for it, and that's okay, that's normal. So, I felt like my sister didn't get a lot of support, even after, sharing that she wanted to breastfeed, and she did meet with a lactation consultant, and right away in the hospital, she was already had her baby starting on formula. So, that was a little disheartening and kind of frustrating just from like a, medical perspective, and just somebody who is very like pro breastfeeding. My sister was definitely aware of like how, important and like beneficial it is for herself and for the baby. So that was good. But we definitely had, we were blessed with a couple of our lactation counselors here that, have taken the time to like reach out and really work with her and like offer their time and support, which is super, super important, for her to be able to be successful in breastfeeding and to just continue, this really important time, like learning and bonding with her newborn baby. So I hope one day, you know, I'm blessed to have a baby and to be able to breastfeed, to experience that. But until then, I definitely plan on like advocating for it and supporting women who need support in this area.
Awesome. Well, thank you so much, Maddie, for joining us today and sharing with us this story about breastfeeding.
Absolutely.